San Diego Unified School District has a no shots, no school policy that requires proof of immunization or documented exemption. But come next year, California's new vaccine law eliminates the personal belief exemption, meaning kids in public and private schools will need to be up to date on their vaccines to attend class. Here with more on how the district is preparing to implement the controversial law are my guests, SD Unified's Nursing and Wellness Manager, Michelle Bell, and UC San Diego professor and pediatrician, Dr. Mark Sawyer. And Michelle, according to KPBS news partner iNewsSource data, about 8% of San Diego County's kindergartners last year were not vaccinated at the start of the year. So what are the immunization requirements for K through 12 students in public schools?
So the requirements are polio. They have to have 4 doses of polio. They have to have diphtheria, tetanus, and pertussis, 4 doses of that. 2 doses of measles, mumps, and rubella, and for the older kids, for the younger kids, hepatitis B, and then varicella.
So kindergartners coming in would need those last 2. What is the district doing to prepare parents for the new vaccine law?
So the nurses will be talking to all of our parents at registrations and back to school nights about what the new law is and when it goes into effect. And for those families that want to do the personal belief waivers for this academic school year, they'll have until December to apply.
So just to be clear, the new vaccine law goes into effect fall of 2016, a year from now. What about grandfathering kids in, as they're going to be the kindergartners, let's say, or the students, maybe even 3rd graders that have had personal exemptions? Will they still have to be vaccinated?
They'll be grandfathered in until they reach their next immunization cycle. So if there's a 3rd grader who's starting this year, when they enter 7th grade, they'll have to have proof of vaccinations.
If they were on personal exempt.
If they were a personal belief waiver.
I see. Now, Dr. Sawyer, you work with the county's immunization registry. What does San Diego County's registry tell us about how many kids are not vaccinated?
Well, the registry is not the best way to really figure that out because not all kids are in the registry. So the data that you've been looking at on the school website is probably the most accurate because every year each school has to report the % of children who are unimmunized. But what has physicians concerned and ultimately led to this new law is the rate of these exemptions has been gradually going up over the last decade, and it's reaching a threshold where we are going to see outbreaks of disease.
In last December, speaking of that measles outbreak that started at Disneyland, about 147 people were infected. Now, many of those were not immunized, but some were. So how effective are vaccines, and what can happen if these vaccination rates aren't met, as you were talking about?
Yeah, that's a very good point to discuss. So measles vaccine is actually among our most effective vaccines. With a single dose, about 95% of people are immune, and with 2 doses, it goes up to 98%. But it never makes it to 100%. So even people who are immunized may get wrapped up when an outbreak gets started, like the Disneyland outbreak. And that's important for parents to know. That's one of the reasons for this bill, is that we keep these diseases out of schools so that they never get a chance to get hold.
What do you tell parents, though, that, speaking of these personal exemption beliefs, that are concerned about vaccine safety?
Well, my opinion is that parents who choose not to immunize their children are doing so because they haven't received accurate information. There is lots of information available on the internet. Some of it's excellent, some of it is actually very bad and frankly wrong. So my advice to parents is not to rely on the internet, but talk to their healthcare provider about the risks and the benefits of vaccines. When you get the right information, the parent is going to choose to immunize every time.
Do you think that this new law will actually help dispel the myths about vaccines?
Well, I'm hopeful that it will. I'm sure some people will still resist the information that's available, but the science is very clear. The vaccines are safe, and the risk from the vaccine, although never zero, is much lower than the risk of the disease.
And Michelle, what about medical exemptions? If you could briefly tell us what that is and what happens to students at school that are under medical exemption.
So with the medical exemptions, we do exactly the same thing. We make sure that they're on record. We have a database. We know who those families are. There's only very few of our students who have medical exemptions, and it's usually for immunosuppressant type illnesses.
So it's very rare.
It's very rare.
Alrighty. Well, I want to thank you, Michelle Bell, and Dr. Mark Sawyer. Thanks so much for the update. And I want to let folks know that San Diego Unified is hosting an immunization clinic at Bell Middle School next Thursday, August 27th from 7:30 a.m. until noon.